Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A client is prescribed lithium for bipolar disorder. Which laboratory value is most important for the nurse to monitor? A. Serum lithium level. B. Hemoglobin. C. Platelet count. D. Blood glucose. Correct answer, A. Serum lithium level. Rationale: lithium has a narrow therapeutic range, so serum levels must be monitored regularly to prevent toxicity. Question 2. A nurse is teaching a client taking fluoxetine, Prozac. Which statement by the client indicates correct understanding? A. It may take several weeks before I notice improvement. B. I'll stop taking it as soon as I feel better. C. I should take this medication only when I feel depressed. D. This medication works immediately. Correct answer, A. It may take several weeks before I notice improvement. Rationale: SSRIs often require 2 to 6 weeks before full therapeutic effects are seen. Question 3. A client taking haloperidol, Haldol, develops muscle rigidity, a high fever, and confusion. What should the nurse suspect? A. Neuroleptic Malignant Syndrome, NMS. B. Serotonin Syndrome. C. Lithium Toxicity. D. Stevens-Johnson Syndrome. Correct answer, A. Neuroleptic Malignant Syndrome, NMS. Rationale: NMS is a life-threatening adverse effect of antipsychotics characterized by fever, muscle rigidity, altered mental status, and autonomic instability. Question 4. A client taking sertraline, Zoloft, should avoid taking which medication without consulting the healthcare provider? A. St. John's wort. B. Acetaminophen. C. Calcium carbonate. D. Vitamin D. Correct answer, A. St. John's wort. Rationale: combining SSRIs with St. John's wort increases the risk of serotonin syndrome. Question 5. Which medication is classified as a benzodiazepine? A. Lorazepam. B. Fluoxetine. C. Haloperidol. D. Lithium. Correct answer, A. Lorazepam. Rationale: lorazepam is a benzodiazepine commonly used to treat anxiety and acute agitation. Question 6, SATA. A nurse is teaching a client about lithium therapy. Which instructions should be included? Select all that apply. A. Maintain consistent sodium intake. B. Drink 2 to 3 liters of fluid daily unless restricted. C. Report vomiting or diarrhea promptly. D. Stop the medication abruptly if symptoms improve. E. Attend regular blood tests. Correct answers, A, B, C, E. Rationale: stable sodium intake, adequate hydration, regular blood monitoring, and reporting fluid loss help prevent lithium toxicity. Lithium should not be stopped abruptly without provider guidance. Question 7. A client taking clozapine, Clozaril, should be monitored closely for which serious adverse effect? A. Agranulocytosis. B. Hypertension. C. Hyperglycemia. D. Cataracts. Correct answer, A. Agranulocytosis. Rationale: clozapine can cause severe neutropenia, agranulocytosis, requiring routine complete blood count, CBC, monitoring. Question 8. A nurse is caring for a client receiving diazepam, Valium. Which side effect is most expected? A. Drowsiness. B. Hypertension. C. Tachycardia. D. Hyperactivity. Correct answer, A. Drowsiness. Rationale: benzodiazepines commonly cause sedation, dizziness, and impaired coordination. Question 9. A client taking phenelzyne, an MAOI, should avoid foods high in tyramine to prevent A. Hypertensive crisis. B. Hypoglycemia. C. Bradycardia. D. Renal failure. Correct answer, A. Hypertensive crisis. Rationale: tyramine-rich foods can trigger severe hypertension in clients taking MAOIs. Question 10, SATA. Which food should a client taking an MAOI avoid? Select all that apply. A. Aged cheese. B. Pepperoni. C. Red wine. D. Yogurt. E. Fresh apples. Correct answers, A, B, C. Rationale: aged cheese, cured meats, and red wine are high in tyramine and should be avoided. Fresh fruits like apples and most yogurt are generally not high in tyramine. Question 11. A client taking lithium reports nausea, diarrhea, coarse hand tremors, and difficulty walking. What should the nurse do first? A. Hold the medication and notify the healthcare provider. B. Administer the next dose as scheduled. C. Encourage the client to drink coffee. D. Give an antiemetic and continue therapy. Correct answer, A. Hold the medication and notify the healthcare provider. Rationale: these are signs of lithium toxicity and require immediate intervention. Question 12. A client has been prescribed alprazolam, Xanax, for anxiety. Which instruction is most important? A. Avoid alcohol while taking this medication. B. Take the medication with grapefruit juice. C. Stop taking the medication when anxiety improves. D. Double the dose if one dose is missed. Correct answer, A. Avoid alcohol while taking this medication. Rationale: alcohol increases the sedative effects of benzodiazepines and can cause respiratory depression. Question 13. A client taking risperidone, develops involuntary lip smacking and tongue movements. Which adverse effect should the nurse suspect? A. Tardive Dyskinesia. B. Serotonin Syndrome. C. Neuroleptic Malignant Syndrome. D. Lithium Toxicity. Correct answer, A. Tardive Dyskinesia. Rationale: tardive dyskinesia is characterized by involuntary facial and tongue movements associated with long-term antipsychotic use. Question 14. Which medication is classified as a selective serotonin reuptake inhibitor, SSRI? A. Sertraline. B. Diazepam. C. Haloperidol. D. Lithium. Correct answer, A. Sertraline. Rationale: sertraline is an SSRI commonly prescribed for depression and anxiety disorders. Question 15, SATA. A nurse is caring for a client taking sertraline, Zoloft. Which findings may indicate serotonin syndrome? Select all that apply. A. Agitation. B. Fever. C. Muscle rigidity. D. Tremors. E. Bradycardia. Correct answers, A, B, C, D. Rationale: serotonin syndrome commonly causes agitation, hyperthermia, muscle rigidity, and tremors. Bradycardia is not a typical finding. Question 16. A client taking clozapine reports a sore throat and fever. What is the nurse's priority action? A. Notify the healthcare provider immediately. B. Reassure the client that this is expected. C. Encourage increased fluid intake only. D. Continue the medication as prescribed. Correct answer, A. Notify the healthcare provider immediately. Rationale: fever and sore throat may indicate agranulocytosis, a medical emergency requiring prompt evaluation. Question 17. Which side effect is most commonly associated with tricyclic antidepressants, TCAs? A. Dry mouth. B. Diarrhea. C. Hypertension. D. Increased salivation. Correct answer, A. Dry mouth. Rationale: TCAs have anticholinergic effects, including dry mouth, constipation, blurred vision, and urinary retention. Question 18. A nurse is administering haloperidol, Haldol. Which assessment should receive the highest priority? A. Monitor for muscle stiffness and fever. B. Assess hearing. C. Monitor blood glucose daily. D. Check visual acuity. Correct answer, A. Monitor for muscle stiffness and fever. Rationale: muscle rigidity and fever may indicate neuroleptic malignant syndrome, a life-threatening adverse effect. Question 19. A client taking diazepam, Valium, should be instructed to avoid which activity until the medication's effects are known? A. Driving. B. Drinking water. C. Walking. D. Eating meals. Correct answer, A. Driving. Rationale: diazepam can cause drowsiness and impaired coordination, increasing the risk of accidents. Question 20, SATA. A nurse is teaching a client about taking antidepressant medications. Which instructions should be included? Select all that apply. A. Take the medication as prescribed. B. Do not stop the medication abruptly. C. Report worsening depression or suicidal thoughts immediately. D. Therapeutic effects may take several weeks. E. Skip doses if you feel better. Correct answers, A, B, C, D. Rationale: antidepressants require consistent use, should not be stopped suddenly, may take weeks to become effective, and any worsening mood or suicidal thoughts should be reported immediately. Question 21. A client taking lithium asks why regular blood tests are necessary. What is the nurse's best response? A. Lithium has a narrow therapeutic range and can become toxic. B. The tests check for anemia. C. The medication lowers your blood sugar. D. The tests determine if the medication is working immediately. Correct answer, A. Lithium has a narrow therapeutic range and can become toxic. Rationale: lithium requires routine blood level monitoring because small increases can lead to toxicity. Question 22. A client taking fluoxetine, Prozac, says, I feel much better, so I'm going to stop taking it. What is the nurse's best response? A. Do not stop it without consulting your healthcare provider. B. That's fine if you feel better. C. Take it only when you feel depressed. D. Double today's dose before stopping. Correct answer, A. Do not stop it without consulting your healthcare provider. Rationale: antidepressants should not be stopped abruptly because withdrawal symptoms and relapse may occur. Question 23. Which adverse effect should the nurse monitor for in a client taking olanzapine, Zyprexa? A. Weight gain. B. Hearing loss. C. Nosebleeds. D. Hyperthyroidism. Correct answer, A. Weight gain. Rationale: second-generation antipsychotics commonly cause weight gain and metabolic changes. Question 24. A client prescribed buspirone, Buspir, should be taught that A. It may take several weeks before the medication becomes fully effective. B. It provides immediate relief during panic attacks. C. It should be stopped once anxiety improves. D. It commonly causes respiratory depression. Correct answer, A. It may take several weeks before the medication becomes fully effective. Rationale: buspirone is used for chronic anxiety and does not provide immediate symptom relief. Question 25, SATA. A nurse is caring for a client receiving haloperidol, Haldol. Which adverse effects should the nurse monitor for? Select all that apply. A. Muscle rigidity. B. Tremors. C. Shuffling gait. D. Restlessness. E. Hearing loss. Correct answers, A, B, C, D. Rationale: antipsychotics can cause extrapyramidal symptoms, EPS, including muscle rigidity, tremors, shuffling gait, and akathisia, restlessness. Question 26. Which medication is commonly prescribed to treat attention deficit/hyperactivity disorder, ADHD? A. Methylphenidate. B. Haloperidol. C. Lithium. D. Diazepam. Correct answer, A. Methylphenidate. Rationale: methylphenidate is a central nervous system stimulant commonly used to treat ADHD. Question 27. A client taking amitriptyline reports difficulty urinating and blurred vision. Which side effect does the nurse recognize? A. Anticholinergic effects. B. Serotonin Syndrome. C. Neuroleptic malignant syndrome. D. Lithium toxicity. Correct answer, A. Anticholinergic effects. Rationale. Tricyclic antidepressants commonly cause anticholinergic side effects such as urinary retention, dry mouth, constipation, and blurred vision. Question 28. Which client statement indicates a need for further teaching about benzodiazepines? A. I'll avoid drinking alcohol while taking this medication. B. I'll avoid driving until I know how this medication affects me. C. I'll stop taking the medication suddenly if I feel better. D. I'll take the medication exactly as prescribed. Correct answer, C. I'll stop taking the medication suddenly if I feel better. Rationale. Benzodiazepines should not be discontinued abruptly because withdrawal symptoms, including seizures, may occur. Question 29. A client taking an MAOI develops a severe headache and blood pressure of 210/118 mmHg after eating aged cheese. What should the nurse suspect? A. Hypertensive crisis. B. Neuroleptic malignant syndrome. C. Serotonin syndrome. D. Lithium toxicity. Correct answer, A. Hypertensive crisis. Rationale. Tyramine-containing foods can trigger a life-threatening hypertensive crisis in clients taking MAOIs. Question 30. SATA. A nurse is teaching a client about the safe use of psychiatric medications. Which instructions should be included? Select all that apply. A. Take medications exactly as prescribed. B. Keep all follow-up appointments and laboratory tests. C. Report severe side effects immediately. D. Do not stop medications abruptly unless instructed. E. Avoid alcohol unless approved by the healthcare provider. Correct answers, A, B, C, D, E. Rationale. Safe use of psychiatric medications includes taking them as prescribed, attending follow-up visits, reporting serious adverse effects, avoiding abrupt discontinuation, and avoiding alcohol because it can increase side effects or interact with many psychiatric medications.
And comment below. Don't forget to like, subscribe, and share this video with a friend who's preparing for the NCLEX. See you in the next practice session.